What's up, everybody? How are we? We're going to let a few people come in. Welcome, welcome. Looks like we are live everywhere we're supposed to be live. How is everybody doing today? It's Tuesday, 7 p.m. And this is the Performance Medicine Show. Let's see. Hopefully I can see people. Yes, Steve. Steve, you let me know that Facebook is working. Thank you. Thank you. Got to have a great chat with Steve today. So pumped. Always leave our conversations energized. And it's cool we did on Tuesday because now we got the show. I'm excited. Roel, what's going on, man? Great to see you. Great to see everybody. Let's see here. We got the team in the background and the comments as well. Thank you in advance for that, team. Deborah, what's going on? We're letting people jump in. This is the Performance Medicine Show, Tuesday, 7 p.m. This is where we answer your health and wellness questions. Thank you guys for being in the comments. As you guys know, we're going to answer questions that came in throughout the week to begin with, and then we'll go to live questions generally around halfway through. So really excited about getting to answer some of y'all's questions, or should I say all of y'all's, because we generally get to everybody, and I'm feeling very confident about tonight. Susan, you got to go? I'm kidding. Susan, you can, it's definitely being recorded. Thank you so much for being here. Yes, it's being recorded. When Dr. Rogers gets here in a couple minutes, we record that. You can find that on the Outside the Box podcast, or it stays up on YouTube for a little bit as well. So shouldn't have too many problems finding it. Lisa, thank you for sharing. Thank you to all the sharers out there. Right, let's see here. We had a big day. Tuesday is when all of our emails go out, or should I say, I guess, videos. This one was fun. The Common Sense MD went up on YouTube. It's on the carnivore diet and talks about Dr. Rogers' I guess, journey with the carnivore diet. He used it in particular to help with a gut issue after taking a combination of antibiotics and steroids. So he's on the carnivore diet all the time right now. We'll get to talk to him a little bit about that tonight, I'm sure. This one, Explain This, with the star of the show, Robin Riddle, our nurse practitioner in Knoxville. Was on TRT and fertility. This is a big question we get inside of our offices. When you go on hormone replacement, you got to have that conversation around whether or not kids are in your future. And this is how we approach it. Very, very strategic. So if you guys, that's just something everybody should watch if you're interested in hormone replacement. It's a really important conversation that not enough people have. So thank you to Robin for explaining that on Explain This. And then my man Lucas Schmidt put up a video today on lemons and limes. So basically what you're going to get out of that is if you're not using lemons and limes as an additive in your food, you're missing out not only on a lot of good taste, but also some nutrients in there. So check out that to learn how to use lemon and limes, lemon and limes in your food. Bianca, what's going on? Great to see you. Great to see you. Katie, I saw Katie in Knoxville today, and she's in Kingsport now. She's all over the place now that we have 5 offices. She is 81 is your friend, I'm assuming there, Katie. Although you shouldn't be going 81 on 81, you need to be going 70 to 75. We got to agree on that. Carol, what's up? Great to see everybody. We're going to get Doc in here shortly. But I'm going to do this for Katie because I know she'll be mad at me if I don't. We've got a humongous Black Friday sale coming up. I'm going to put this up a couple different times this evening. And these are all of our specials going on all week long during Black Friday. So the week of Black Friday, we're running specials the entire time. Don't worry, I'll put this up a number of times throughout the show. If you're a patient at any one of our offices, you'll see this very flyer. And even if you're not a patient, you can take or a current patient, you can take advantage of a lot of this stuff. So make sure you kind of, I don't know if you can save that. I don't know if you can save that. I'll be honest. I don't know, but we're going to have it everywhere. If you want me to put it up again, just tell me. And we're going to put it up. Goodness, we got Jasmine in the building, our esthetician in Fountain City and Knoxville West. Jasmine, what's going on? I know you got some specials on the Black Friday week as well. So be sure to take advantage of those guys if you're in the Knoxville area. So pumped to have you in here, Jasmine. Thank you. So we're going to get Doc in here shortly. You can screenshot. I would love it if you guys screenshot. I think that'd be great. I kind of want to do like a little added special if they screenshot it and like share it. Maybe we can like do something around that. I think that'd be fun. Maybe like a little extra performance medicine show added bonus discount or something. All right, guys, is everybody ready to roll? We're getting ready to take some questions here. I'm getting ready to hit record. Thank you in advance for all the great questions. Barbara, I see you. We're in Florida, Barbara. I'm this time of year is the best time of year to be in Florida. So I think we're jealous. I'm sure a lot of people in the comments are going to be jealous of you. All right, press record. Doc is ready to roll? No? Is he ready? Cool. All right, pressing record. What's going on, man?
Hey, Ben. I'm really jelly of Barbara too in Florida. You know,
you come out with jelly in the first 2 seconds of being on here, and you expect me to like. Well, how am I supposed to go into the questions here after hearing you say jelly?
I thought you young people use jelly for jealous. That's why I was using it.
I think it's more like older people who want to be young use the word jelly.
Well, I'm definitely an older person that wants to be young.
Well, you know what? You know what? I think I fall in that camp a little bit. I'm in my mid 30s, and you know, and I'm just going to put this back up here because I think our Black Friday week is going to be full of things you can do if you're wanting to look a little bit younger, and using terms like jelly. If that's in your lingo, then that's a quick sign that you need to take a look at that left-hand column, the metastatic column for this Black Friday. How was the day, man?
The day was great.
Yeah.
Very busy, but good day. You know, I got a good walk in at lunch with Ernie, and actually we went to walk down to vote. You know, we vote within
nice
3 blocks of our office. So did that and just had a beautiful day. I mean, it's a gorgeous day.
It's shockingly warm, but I'm enjoying every bit of it. I see Montana's here from our West Knoxville office. So good to see you, Montana. Thank you for coming to the golly. We got to give a huge shout out to the Knoxville Women's of Health, the first, hopefully, of many Knoxville's Women's of Health. It's like an event. We get together. We have vendors. I was there, and I'm not a woman. I was more of just I was just someone who like carried things in. So that was the value I brought to the whole thing. But shout out to everybody who came out. That was at our Fountain City office, Knoxville Women's in Health. That's going to be a big, big thing. gonna do that hopefully on a really regular basis, and I'm very much looking forward to that. Thank you, Jasmine and Margot, for heading that up. All right, Doc, you ready to roll?
Yeah.
Let's see. We got some great questions coming in. I'm going to start with the Cleveland Heart question. Okay, I see that on the Cleveland, the TSH and T3 are tested. Are those the only two thyroid pieces that need to be tested? This is a Cleveland Heart question.
Yeah, really just for routine screening, and that's a free T3. There's a difference between total and free T3. But yeah, I mean, those are the two numbers I go off by more just for screening, because the T3, the free T3 is the active form of thyroid. And I'll look at the TSH. A lot of people your typical doctor will just check a TSH and a T4, which really doesn't give me enough information. Now, sometimes if somebody has a thyroid problem, I'll dig deeper into it, getting things like I'll check a free T4 as well as a free T3. I'll check TPO antibodies, maybe a reverse T3, so that you can dig pretty deep on it. But for most people, as a screen for their thyroid, those are the two numbers that I need to look at, for sure.
All right. Thank you for that question. I know there's another Cleveland Heart question in here. I'm going to stick with Cleveland Heart for a minute. How do you determine to give a female in her 50s DHEA in their bioidentical hormone replacement therapy? I don't think I saw the DHEA on my Cleveland. Did I? What's your thoughts on this?
Yeah, no, it's not a routine part of the Cleveland, because they tack an extra charge on there for that. I do like checking DHEAs. For most people, especially in your 50s or older, it's going to be suboptimal. So I always add it to the cream when I give BHRT. But sometimes I will check levels. It's very informative. It's just because of the cost, I don't routinely put it on there. But it's a good point, though. Really good point. Most people need a little bit of DHEA. So you don't really need to check your levels unless you're really picky about it. Or if you have some kind of problem, then you do. But yeah, I wish it was routinely on there, to be honest with you. But great question. Great. And if you ever want us to add that, just ask for it. So certainly, I had an interesting patient yesterday. An interesting thing about when you look at labs, like if you get we always do a metabolic panel, which gives us your kidney function in the form of a creatinine and a GFR, glomerular filtration rate. And it shows how your kidneys are functioning and filtrating your blood for waste. And a lot of times you'll see somebody that's really fit, that has a lot of muscle, they'll have a little bit high creatine levels and maybe reflect a slightly lower GFR. You start thinking, is this patient, having early stages of kidney failure? Really not, because their muscle mass makes the routine lab work kind of obsolete. So what you can do is check something called a cystatin C and calculate the GFR based on the cystatin C, not the creatinine. So, and most of the times it's normal. So if you see a muscular male or female, usually see more males in this category, and they look like they have a little renal problem because their creatinine is a little bit high, it just really means they're building muscle, and they have less fat mass than they do muscle mass. So you can have them calculate it with a cystatin C instead of using the creatinine, and it gives a much clearer picture. So a lot of times that alleviates their worries. So, so in a lot of these labs, you have to really know kind of what you're looking at and what you're doing. So, and on the Cleveland, nobody has a perfectly optimal Cleveland panel. I don't think I've ever seen it. I've seen pretty close, but not perfect. So a lot of people worry about, gosh, my MCV was a point high. and yet everything else is normal, and they start worrying, and I try to alleviate their anxiety and say, hey, this means nothing. So that's a good part about looking at a lot of these Clevelands and kind of knowing what to worry about and what not to worry about. I think I'm going to do a series of podcasts on worry about this, not that. I think I'm going to get some specialists on there in their fields and get a list of, say in cardiology, what you should worry about, what you shouldn't worry about. So it's really interesting.
I love that idea. And one thing about the Cleveland, it seems like you're looking at it overall. So you're also looking at the whole thing, but then you're breaking it down as well. But you're not going to be super worried about one thing being maybe a tad bit off.
Right.
All right. Great stuff. Great question there. Grandma Mary's in the building. Thank you so much, Grandma, for being here. I love that she's watching.
Yeah, me too. She's amazing.
Okay, let's put this up here. Okay, I love this question. I'm 42 years old, was recently put on Protonix in the morning and Pepcid at night for indigestion. I had an endoscopy, which was clear. I'm miserable half the time with burping and indigestion. Question is, what do you recommend? I'm at a loss for what to do or try. With a little added context here, the indigestion causes a high heart rate, and we're wondering whether or not that's normal. What's your thoughts on this?
Yeah, that's an interesting question because you don't really want to have to take Protonix the rest of your life. Really, it's only indicated for a couple of weeks, unless you have a really serious condition like a Barrett's esophagus, where the pathology on your esophagus has changed, predisposing you to develop esophageal cancer later on. But so you're on that and it's still not working. You had a normal endoscopy where they scoped you. So you don't have a Barrett's esophagus. You don't have an ulcer. And hopefully did an H. pylori test while they were there to see if you have that bacteria called H. pylori that causes most ulcers. So the deal is you have reflux. And what I would try to do is, instead of putting a Band-Aid on it and try to put you on Protonix all the time, which, will cut all the acid out of your stomach, which you need to digest your food and absorb your minerals. So you have a lot of dangerous things that can happen down the line if you take that for too long. So look at the kind of food you're eating. The first thing I would do is look at your food patterns, what you're eating, the timing of the eating. You may have a little hiatal hernia. You may be overweight. I don't know. You may have slower gut motility. The first thing I would put you on is something like Digest Shield. And I'd really look very hard at what kind of foods irritate your stomach worse than others. Certainly you don't eat and lay down. You don't ever do that. You have a lot of gas with burping. You could certainly try some methicone, Gas X for that. There's some other ones that work for that, but you sound like you're not digesting your food. Your foods are not moving through. So I'd like to look at what other medications you're taking, but most of all, what foods you're eating. People have different tolerances to different foods. So certainly, you probably want to stay away from a lot of spicy, greasy, fatty foods, citrus, coffee, things like that can irritate it. Raw vegetables. You may even, if you looked at my podcast or note from today, you might even try doing a carnivore diet. A lot of times I think that helps severe GERD as well. You need to really think about that. Maybe doing some intermittent fasting. Some people swallow air a lot. Now, when your gut's churning and your blood's going to the gut trying to heal it or get, nutrients from it, it could raise your heart rate. There's no doubt about that. So yeah, it could be. I mean, again, I'd like to run more testing on you, maybe a GI map. Definitely, at the very least, look at what you're eating, put you on Digest Shield, maybe some methicone. I don't know what your bowel movements are like, but you really need to get to the bottom of this thing. like Steve was saying, 15 minutes, digest shield 15 minutes prior to eating the meals, optimal. Twice a day, your 2 meals of the day that you're going to eat. So really, you need to come in and talk to somebody like us, a functional medicine doctor that looks a lot at gut health, and because there's an answer here. That's not right. I mean, there's other things that could be happening. You could have a gallbladder problem. You could have bile acid malabsorption. It'd just be interesting to consult with somebody like you who's having these problems, because there's an answer there. Something's off. The GI map will map out your entire gut microbiome, and that's just a great question and a great patient. You'd be surprised, Ben, how many patients we see with gut problems.
Yeah.
Last patient I saw tonight, half hour ago, has had some severe gut problems over the past almost a year.
And I think, do you think, out of curiosity, based on kind of what you got from this last patient, do you think they recognized it like for a whole year, or did it take them a year to recognize that their gut was way off? I'm interested in figuring out, like, does it take someone a long time to figure out that their gut isn't functioning properly? Or
sometimes, but a lot of times, if you look at the history and talk to the patient, it's pretty obvious.
Yeah.
Because the first thing I'd ask is, how's your gut functioning? Most of the time, not good.
And they know that. They know it's not good.
They usually do, but they don't realize the importance of it. And what they may be doing, that may be upsetting it. I mean, one good reason to eat a carnivore diet is because, red meat has a lot of carnosine in it. And carnosine kind of binds up some of the things that are kind of inflammatory for you, like sugar, and carries it out as waste. So it's just really interesting. I would get some Digest Shield, maybe try the carnivore diet if you haven't tried that, or even maybe a FODMAP diet. And that's another one that may work, because when you have a lot of gas, if you eat a lot of things that are going to ferment in your stomach, that may cause a lot of gas. So I'd get to the basis of what I'm eating, and I'd probably go ahead, and if it's been going on for a while, I'd go ahead and get a GI map, which is a stool test. It's very comprehensive. It gives us a lot of information. There's even H. pylori assay on that one too. So hope that helps you.
I'll go ahead and remind everybody, we got one more question here, and then we're going to take live questions. So if you have a question for Dr. Rogers, go ahead and put it in the comments. We're going to get to those in just a few minutes, and we're going to get to every single one tonight. We're excited. Is this daylight saving times, or which one are we in?
No, this is Eastern Standard Time.
It's Eastern Standard. It's pitch black outside at 7:20.
I know. I'm still going for a bike ride later, though. So,
are you really?
Yeah, I'll take my light, and it's very warm out there still. So while I still can, of course, I'm going for a bike ride.
Well, of course. You know what? Why wouldn't you? I love it.
I mean, all I've done. Well, I did work out this morning, but then I take a walk at lunch. I like to get out on the bike at night.
All right, we're gonna keep moving then. This is a question around pain medicine, and we've talked, a little bit about this this year, which I think is so important. And it's a longer question, so I'm going to break it up. I had an extremely long visit to the ER this week with a family member. When pain meds were asked for, we were assuming extra strength Tylenol. They came back with the oxycodone option, which we declined, and had to then ask for the Tylenol option. The question is, would the oxycodone option really work that much better? Wondering what the pain-reducing difference is between oxycodone and extra strength Tylenol or ibuprofen. The context is the extra strength Tylenol worked really well, but they had to be adamant to refuse the other, which is super interesting. So what's your thoughts on this?
Yeah, I agree with what you did. I mean, oxycodone is a terrible drug. And if you have cancer, or, you just broke your leg, or you got your wisdom teeth pulled, you need it for a day or two. It's definitely more potent, but it also, has a lot of side effects too. You're going to be kind of out of it when you're taking that. That's why so many people get addicted to it. I've known many good doctors that have become drug addicts by starting on oxycodone and hydrocodone. Oxycodone is a little more potent than hydrocodone, but they become addicts because of a legitimate reason for getting on it, like a kidney stone or post-surgery. So if you can get by with taking extra strength Tylenol, you don't even have to ask for that. Just get it yourself, or ibuprofen. But yeah, I mean, a lot of times, I guess doctors assume you come in there for pain and you want something, but for me and the people that I know that are smart, they refuse it unless they're, really in that much pain. They have a kidney stone, or they just, or their pain levels 8 to 9 out of 10. So yeah, oxycodone is a dangerous drug, very addictive, and after you use it a couple of weeks, it's no better than Motrin anyway. And then by that time you're hooked on it. I've seen people get hooked on oxycodone within a week to 2 weeks. I mean, it's just a horrible thing to have to do. So, I don't want it, for sure.
Well, it's such an important question, and so I'm glad that was brought up, and great answer there. We've got one more here, and then we're going to get to the comments. As you guys know, this is a performance medicine show. We're going to answer health and wellness questions in the comments here in about a couple minutes. Okay, let's see here. Where am I at? Okay. I have learned so much following you the last year and a half. Thank you. Thanks for the kind comment.
Thank you.
I have one at a time added so many supplements to boost immune system, etc. And I'm now ready to add one for brain health or memory, brain health / memory. If I only want to add one, which would you recommend? As I've heard you talk about a few over the last year. So it sounds like if you had to add one kind of brain health / memory supplement, which one would it be?
Probably the one I take, Cognatex, that Life Extension makes. It has phosphatidylserine, phosphatidylcholine. Any of the ones that have Bacopa in it are pretty good too. Even, we talked about methylene blue. If you're a woman that has frequent UTIs and you want to there's your cognition, then methylene blue drops are really effective. Kill two birds with one stone, but probably Cognatex. There's several out there. Here's mine right here. I just handed it. I took it this morning. So
I love it.
There's a lot. If there was one I would take, which I do, I take this one. I was at a conference one year in California, and a famous neurologist was up there, and he was talking about vitamins for the brain. And somebody from the audience asked him, if you're on a desert island, what would be the one vitamin you would take? And, you'd think he'd choose D or C or one of those. Of course, being a neurologist, he said Cognatex. I'll never forget him saying that.
That's interesting.
So, yeah, that's a really good, brain's important.
All right. That's a great question. Thank you for bringing that up. Cognatex Elite from Life Extension is the answer there. All right, guys, that does it for the questions that came in throughout the week. Thank you in advance to the people who sent emails in, commented on Facebook or Instagram. We really appreciate that. So if you have questions for Dr. Rogers, go ahead and put those in the comments. I have not, I don't think I've seen one yet. So if I'm missing one, kind of pointed out to me. But until then, I do have a question for you, which is around this one. So, you talked about the carnivore diet, and this is something that you're exploring right now yourself. There is a marker on the Cleveland Heart that you've been watching for that has to do with red meat. And what is it? Remind me.
Oh, the TMAO.
The TMAO. Tell me kind of how you're thinking about that now that you're starting to or you will be eating more and more red meat.
I'm probably going to leave that TMAO measurement off in the future on my Cleveland because it kind of gets confusing and I'm not sure it means a lot anyway. The theory behind it is really an indirect measure of your gut microbiome. And traditionally, I said, well, if your TMAO is high, you should eliminate red meat and egg yolks because they have choline in them. But really, when you take a little deeper dive, and if you want to explore that, um, you can read the book, The Carnivore Code, and maybe look at that a little bit further. And because I did take a deep dive on it, I'll probably start ignoring it, to be honest with you, because I don't want to discourage people from eating a carnivore diet. Now, again, the carnivore diet, there's tens of thousands of people that eat that every day for years, and they do great. There's some people that just do it to kind of restore their gut function or lose weight or, an easy way to eat less carbohydrates. So it has a lot of different functions. So, the carnivore diets, I know it's all the rage right now, but it's been around for a long time. And for a lot of people, it works pretty well. Again, like I said in the note today, everybody's different. So, I mean, some people do better on a vegan diet. Other people can't digest plants' fibers very well. So they do better with a carnivore diet. And you can look at your numbers and see how they change. For most people, their cholesterol doesn't go up, even though they're eating a lot of saturated fats. And now we know, of course, that saturated fats do not cause heart disease.
Mm.
Um, it's more the polyunsaturated fats, the PUFAs and the inflammatory omega-6s like linoleic acid. We measure those on the Cleveland and can come up with a plan for you. But the TMAO for right now, it's on hold. Great question.
For you in particular, or
Yeah.
just on? Okay.
And I'll experiment on myself. I'll follow my levels just to see if they mean anything.
Got it.
But if you read the note today, the reason I got on the carnivore diet is to straighten some gut problems I was having out as a result of kind of like what I call the perfect storm. I had to take a little prednisone, had to take an antibiotic, and then COVID.
Yeah.
Mild case of COVID that triple play kind of messed my gut microbiome up.
It's a really cool conversation. I'm really looking forward to following this. And I know our nutrition coach Lucas Schmidt and maybe even Andy are gonna do. They're gonna do like test on themselves where they're gonna take their labs and follow it with a carnivore type diet. Is that right?
They are. Yeah, it's going to
Cool.
be, Lucas is an amazing nutritionist. He's our go-to guy. And Andy, of course, is a type 1 diabetic. So this could be really interesting. I predict he's going to get a lot better glycemic control with the carnivore diet. Just listen to your gut. And if you can't digest vegetables, then, maybe you shouldn't be eating too many vegetables. There's pros and cons of eating vegetables. And one of them is stomach upset. If anybody has IBS, I almost diagnose it by saying, "Hey, what happens when you eat a salad?" And they go, "I can't eat a salad." Well, you probably have IBS. So it's going to be really interesting to see kind of what happens on this. But it's just good for your gut microbiome in a lot of ways. It's by definition a low carbohydrate diet. Plus, those animal proteins are much better absorbed than plant proteins. So you're probably going to build more muscle than you would on a regular diet. And again, it may not be for long term for some people. Most people are going to end up on a blended type of diet.
Yeah.
But we'll kind of follow that. We'll have more updates and more podcasts on the carnivore diet as time goes on.
Yeah, we will definitely be talking more and more about it. It's safe to say, and I want to get to my friend Chuck's question here shortly. Real quick, I had a phenomenal question for you, and it just left me. it just left me. So that means, Chuck, we're going to get to your question. Chuck is asking, can berberine be taken with metformin, or is it one or the other?
It could be. I usually use one or the other, but it's not going to hurt to add berberine to metformin. I think berberine works almost as good as metformin without the GI side effects that a lot of people have with metformin. So, a lot of it depends on the individual case. Are you diabetic? Are you extremely insulin resistant? What dose of metformin are you on? Sometimes just to get the benefits of both, I'll give both, like just a 500 milligram of metformin and one berberine. So you kind of hit it from two angles at a lower dose. So that might be a good thing you could try, Chuck, but it's not going to hurt you.
Thank you for that question, Chuck. Thank you for being here, man. I want to put this from Katie, TMAO trash. Katie's on the carnivore. Is she all carnivore, or is it? I think she's maybe
pretty much
modified.
Well, she's probably on Dr.
Modified.
Saladino's modified with fruit and honey, seedless fruits and honey. And
is Ben on full carnivore?
No, he switched from full to the modified.
Super interesting. I love it. I think this is so fascinating. Okay, Becky is asking, have you ever heard of mast cell activation syndrome? And then the question is, what would you recommend if you have for MCAS?
Yeah, that's mast cell, not mast cell. It's MAST cell. Yeah, That's just an overactivity of your mast cells, which are involved in allergic reactions, sensitivities of all kinds. Yeah, we treat some of it. There's a good orthomolecular product called DHIST that I use a lot. It's a really good product. But I think I have some here. But look and see, obviously with that mast cell activation syndrome, your body kind of overdoes it. It reacts too strongly to different things that trigger it, to different triggers. It can be one of many things, but you have to kind of use antihistamines and including H1 and H2 blockers like Pepcid and maybe Zyrtec. And then the DHIST that you get from Orthomolecular, which is an over-the-counter supplement, I think works pretty well. But yeah, that's not a fun thing to have. I don't have many patients that have identified as of having it because it's kind of a hard thing to really diagnose. Some people go to an allergist and get that diagnosis, but if you're having severe issues, that's what I would suggest you do. But you definitely want to look at your gut function as well, because a lot of these sensitivities come from foods and the gut and certain triggers. Great question, though.
Thank you so much for that question, Becky, and thank you guys for putting in your questions. I'm seeing them come in. Keep them coming. We're going to get to all of them here. I see T-Mac is talking about a flu protocol. What is your flu protocol right now? Anything that kind of stands out for you?
Yeah, if we're seeing some flu, we definitely are. There's a triple threat out there: flu, COVID. I treated several of both today, and RSV, which is mostly in little kids under 2, although some older adults could be at risk for having a worse case of it. But little kids get really sick with that sometimes. I think something like 75% of the beds nationwide, pediatric beds, are taken up by it right now. So, if somebody definitely tests positive for flu, I usually use Tamiflu pack on them. I think that shortens the duration of it and certainly helps their symptoms. Definitely bump up your D to 50,000, bump up your C to 4,000, take zinc, and very similar to what I would do. I usually don't use the antiparasitics for it, but it won't hurt you, but I just don't know how effective it is for influenza. But yeah, drink a lot of fluids and to get some chicken noodle soup. Get your mom's chicken noodle soup.
There you go.
Sweat it out in the infrared sauna like I do. And also, well, the other thing you might want to do if you're um, use that betadine nose spray and throat spray. I think that helps whenever you come down with any of this stuff. And maybe even a little silver, colloidal silver up in your nose and in your throat. I think that works pretty well too. Great question, because we're seeing a lot of it.
Thank you for that, T-Mac. I'm just going to piggyback with Mark's question because they're very similar. What medicines do you recommend in a home medical kit to treat the flu, RSV, and bacterial pneumonia?
Yeah, of course, Tamiflu kit. I wrote 2 of them tonight for a couple that was going down they're going to take a trip to Singapore, and they wanted a home medical kit. And certainly I included Tamiflu. I did include that anti-parasite drug that we use so much of. RSV, there's no real defined treatment for it other than your vitamins and all and antihistamines. For bacterial pneumonia, Zithromax, maybe doxycycline. I like having both of those, to be honest with you, because Zithromax is really good for sinus, bronchitis. Doxy is real good for if you got a staph infection or something. It also works great for pneumonia and sinus infections. I recommend that, you have some Zofran around and maybe some activated charcoal, some Imodium. I even prescribe an EpiPen to this couple that's going overseas because the husband had pretty severe allergic reactions to shellfish, and there's a lot of it over there. So did that. So that's the main stuff. Take a lot of vitamins over there too. Let's see, D, C, and zinc. And also maybe take some NAC, quercetin. That'll all help.
Thank you for that, Mark. Let's get to, I'm at Roel's question. Doctor, how much suggested milligrams of boron would you recommend daily for a male?
Man, I'm going to have to look that up. You've got boron, copper, and zinc. Boron's really good for preventing prostate problems. I'd have to look and see. We have some in the office. I'm not sure on the dose of the boron. I'd be afraid to tell you right now because usually it comes in the multivitamin. But I'll Ben, let's get back with him on that recommended dose of boron. Great question, though.
All right. Thank you for that, Roel. Writing that down. Let's get to Lisa's question. Am increasing torsemide to 60 milligrams and spironolactone.
Well, you had a hard time with those two.
To 50 milligrams daily. I'm sorry, Lisa. To help with a fluid retention. What is a safe amount of days to take these meds at this dosage, please? Thank you.
That's a pretty good dose of torsemide, which is kind of, to my mind, a little bit more potent than Lasix. Sometimes work when Lasix doesn't. But a spironolactone, that's kind of a mild dose of that. The torsemide could deplete your potassium. Spironolactone could help you hang on to it. So you're on 2 fairly potent diuretics. So, I don't know that I'd start both of them. Really, spironolactone, we use it more for people that as a DHT blocker for acne and also works pretty well for mild congestive heart failure. But it's a lot milder. When you have a lot of fluid on your extremities, like you've got pitting edema on your lower legs, then something like Lasix or torsemide is probably going to be better. You have to watch your potassium. You have to watch your kidney function on that. So, certainly if you're on both those, I would say, in a month, you need to get labs and see where your potassium and your kidney function are before you continue with that. And hopefully wean off to a low dose of 1. It'd be great if you could get by with just spironolactone itself, and you can certainly work your dose up on that. That's a pretty mild dose of spironolactone, but a pretty heavy dose of furosemide. But great question. Great question.
Thank you. Thank you for that, Lisa. And let's get, this is a quick one for Lisa. Is berberine over the counter?
Yes. Yep. Great,
right.
Great supplement.
Berberine is over the counter, Lisa. Thank you for having us say that, because a lot of times we talk about berberine and people don't realize that is in over the counter.
Unlike metformin,
Yeah.
It's a lot milder than metformin, a lot less side effects, and it works pretty well.
Rose is asking, have you heard of Vitapulse for lowering cholesterol? If so, can it take the place of statins?
I haven't heard of Vitapulse for lowering cholesterol. I'm not sure what's in it.
I'm gonna.
One of my favorites for lowering cholesterol, if you're taking a supplement, would be garlic or hawthorn, of course, niacin. So I'm not sure what's in Vitapulse. Ben, you write that down. I'll check it out and we'll get you an answer. So right now, I don't know what it is. It sounds like an over-the-counter supplement.
Rose, I wrote that down. That will be a prompt for me if we will do some research on that. I'm putting this up from Katie for Roel. Boron is 3 milligrams.
Thank you. That's right. Yeah, we do carry it. And it's great for your prostate.
So thank you for that, Katie.
Great for your bones too.
It is 3 milligrams. Okay, let's get to Steve's question. I have high cholesterol. Another cholesterol question. I have had simvastatin prescribed, but it started hurting my muscles after a few weeks and was discontinued. I began taking garlic, bergamot, niacin, and fish oil to see if supplements would help. My last blood test revealed my high cholesterol is still too high. Any suggestions? Are there different types of statins that may not be as problematic as the simvastatin I took?
Could be, yeah. A lot of times you take one, it'll cause muscle aches, and another one won't. My favorite one is a water-soluble one called rosuvastatin or Crestor. And a lot of times I'll dose it just at a real low dose, 5 milligrams 3 times a week, and that will help. Of course, when you take any kind of statin, you need to take CoQ10. That will help the depletion that takes place when you take a statin and depleting your CoQ10, which is essential for your mitochondrial function for energy production, ATP. So, you might try that one along with CoQ10. And there's some other new things that are coming up to lower cholesterol that aren't statins. PSK inhibitors. I don't use them, but there's some things out there that are more potent prescription medicines to lower your cholesterol if you have that inherited problem where you just have type 2 hypercholesteremia. So you might ask about that, but definitely you want to try some low dose Crestor at 5 milligrams 3 times a week. And CoQ10 is a must. It's very heart protective and energy providing supplement overall. I love CoQ10. And I like to use PQQ with it. That's what's in my Dr. Rogers energy supplement. The CoQ10 makes your mitochondria crank out more ATP, but the PQQ helps your body produce more mitochondria. So you're hitting it from both angles, and I certainly take both of them. I think it helps. But you can try that, Steve, and see what happens. And again, don't freak out too much on just your total cholesterol. Most doctors just are looking at your total, maybe your HDL and your LDL, but you really need to look at the ApoB, and particle size and that type of thing. Something like the Cleveland panel provides. If you have a perfect heart score, no risk factors, I don't treat moderately high cholesterol just for nothing. I mean, look at the side effects it can cause. So you have to look at it. You have to consider everything. before you choose a statin for everybody. But
Great question there. Yeah. Okay. Thank you for that, Steve. I'm going to get to Robin's question here. I think that's where I'm at. If I'm skipping people, I apologize. Let's get to Robin on Facebook. Is it possible to take too much vitamin B? I have been taking two tablets of B complex per day for several weeks, and it took the beginning feeling of neuropathy away. What's your thoughts on this?
I think you could take too much of anything. But certainly in the recommended doses, like 2 of those, that's certainly not going to hurt you. The B vitamins are water soluble. If you took too much niacin vitamin B3, you can certainly cause a lot of flushing and uncomfortable feeling. What probably worked for your neuropathy was B6. What's interesting about B6, if you take the normal dose of it, it helps it. If you take too much of B6, it may make your neuropathy worse. So certainly it is water soluble, so it's safe. It doesn't accumulate in your fat like a fat soluble vitamin would. So 2 tablets of a B complex, I don't think it's going to bother you. You're just going to wash it away anyway. A lot of times when we check B vitamins levels, like especially B12, it'll be high. And it just means you're taking B12. A high B12 means practically nothing. A low B12 means something. So hope that helps.
Thank you for that question, Robin. Let's get to Roel's got another question here. Doctor, have you heard about the new study from the University of Houston about the sole's push-up muscle?
No, anything that comes out of Houston, I don't trust it, or Texas for that matter. I'm kidding.
He's kidding. He's kidding.
Remember the Alamo? I mean, Sam Houston was a Tennessean who went down to the Alamo. In case you didn't know that. But, so was Davy Crockett. No, I haven't heard about it. The sole's push-up muscle. And I haven't heard about that. I'm going to look into that, though, because I'd like to have more push-up muscle. Have you heard of that, Ben?
I have not, but I'm writing it down, Roel. And
I'll look that up tonight because that's piquing my interest in that.
Thank you for that, Roel. We've got a couple more minutes here. Let's see. This one from Lisa is one that you can answer quickly. Is vitamin K alone good for bone health? If so, what is the dosage amount?
Yeah, very good. Of course, vitamin K makes vitamin D work better, so hopefully you have an adequate vitamin D. But yeah, my favorite, there's K1 and there's K2. K1 is plant sourced, K2 is animal sourced. It's better. The one I like, and there's like 12 different forms of K2. So the one I like, Lisa's MK7, 180 milligrams once a day. That's the optimal in my opinion. But make sure your vitamin D is good too. It actually works in conjunction with vitamin D.
To get to D-Lyn real quick, how much berberine should a person take that is pre-diabetic?
Gosh, I don't know the milligram on our berberine, but if pre-diabetic, I'd still just start out with 1 pill a day of berberine. Because you're a lot less likely to have any side effects from it at one of them. I mean, you can still get a little bit of stomach upset, just like you can metformin. If Katie's sitting in the office, she probably is buy some berberine. She could tell you that, like she did that other question for us. But
we will. What I'll do.
She never leaves the office. 400 milligram. I thought it was 400 or 500. See, she's still at the office.
She's still there. Thank you so much.
Have you got nothing better to do, Katie, than hang around the bottom shelves all night?
Katie, thank you so much. 400 milligrams D-Lyn for berberine. I'm going to put this up just because I think Mark's trying to. Here's what I think. I think Mark's trying to play a trick on me because about half these words he knows I can't pronounce. And Mark's a good friend of mine, and he's thinking, you know what? I'm gonna try to stump Ben and add this question in here. So I'm just going to give it a go for just to entertain Mark. I don't know if we'll have an answer or not, but Mark, I know what you're up to, man. Here's the question. What are your thoughts on the use of gamma glutamyl cysteine to increase glutathione for mild glutathione synthetase deficiency or hemolytic anemia? How'd I do?
Man, I think you did great on that. Try to say that real fast. That's a tongue twister if you do it really fast, but you did a great job pronouncing it. I wish I could answer that.
Come on, Mark.
He's just trying to stump you. I don't know. Of course, we use NAC to increase glutathione, NAD+. Those all help. NR. So I really don't know much about it. If you happen to have any articles, Mark, you can send them to me. That's the thing about Mark. He'll give you some articles.
Thank you.
Like a stack of them. Send me some more stuff, Mark, and let me look into that.
Mark said I did great. He said I did great. And let's see if you can answer this one. Cholesterol and triglyceride in the liver were decreased as a dietary addition level of GSH was increased. Any thoughts on this?
No, that seems like it might work, though. I haven't really experimented with it any to tell you if it is, but it's just really interesting. One thing, too, that came up today, interesting about high cholesterol, a lady came in and she had really low thyroid function.
Mm-hmm.
We found her thyroid function was really low because she really came in for a high cholesterol, wanting to know what to do about it. But really, if you have a low thyroid, it's going to falsely elevate your cholesterol levels. So if you fix the thyroid, your cholesterol levels will come back to within normal limits almost every time. Not every time, but a lot of the times. So that's just an interesting thought. So if you have a really high cholesterol and you can't figure out why, make sure you look at your thyroid function test.
Super interesting. And Katie Googled it. Why didn't we think of that?
Well, if it doesn't come out of my head, I don't like to Google things. At least not on the air. No, I don't like to Google stuff on the air.
Let's get Lisa's question in real quick. How much B6 to take for neuropathy?
Katie, what's the dose of B6 we have there in the office? I know you've got it. It's called Pyridoxal is the name of it. That's what it comes under. I don't know why I'm thinking either 100 or 500, but you got to be real careful with not overusing that one for neuropathy.
Yeah.
Because if you do the research, too much can make it worse when just the right amount can really help it. I tell people to take B6 all the time. And that's another one of the B vitamins that can really lower your homocysteine level, which we check on all the Clevelands as well. Okay, 100. I knew it was either 100 milligram.
All right. You know what? No, now I know what Katie was doing. So
maybe she was Googling that.
No, Katie is the Google. That's what she's telling us. Because Katie is the Google. She is Google. So that's what she's not Googling it. She is Google. She's not using a search engine. She is the search engine.
She's probably sitting by my vitamin cabinet at the office looking at it.
I think she just knows, and she's saying that you need to try some beef liver, and that'll help your cognition.
She's big on beef liver. It actually is probably the most nutrient dense food in the world is beef liver.
So, but
if you can stomach it, of course you can get a capsule, but they're not going to be as potent as the real stuff.
Katie's the winner tonight. You know what, Katie, you're outshining us right now because I got to put this up for Noel. I
think I may get Katie to step in here for me.
We got to get Katie. Although I know she's busy in the background getting all this stuff together. So, but we got to get her on the show. She can just hop on and answer these live. So thank you so much for doing that, Katie.
Katie doesn't like to be on live TV. She freezes up too much. So I
Oh,
don't
she
think
do
it'd be good.
fine. She do fine. All right, Roel has sent us the study. I see that, Roel, on Instagram. We will check this
Oh, thank
out.
you.
On the soles muscle.
I can't wait to read that.
We are gonna
Thank you.
we're gonna wrap up the show here soon, guys. Is Dr. Ike gonna make an appearance, or is he too wild?
I haven't seen him around here. Maybe he'll trot down. I think I hear him coming. Ike. All I have to do is whistle when he comes running. Ike. Ike.
No, it's not that simple.
Here he comes. Here he comes. Yeah, look at this. He came right up. Come here. Come here. There he is. Can you see him?
Look at Ike. Look at Ike. You behaving over there, man?
Okay.
Dr. Ike has joined the show, and I see. I know Matt just showed up. I know Matt comes at around 7:56, and he's here for Dr. Ike. There. Look at him. You look somewhat calm.
He's very photogenic. He's made for the camera, I think.
We've got Lisa, Sherry. They're all fawning over you, Ike. All right. Well, guys, it has been a wonderful show this evening. Thank you all for hanging out. Ike, you've got a fan in Misty too. You've got a fan in Lisa. Chuck, man, thank you so much. Thank you for being here. Look, Steve even loves Ike. Everybody loves Ike. Look at that. All right, Doc, you ready to call it a show?
I'm ready.
All right, guys, that's going to do it. Thank you, Dr. Ike, for showing up. Guys, this has been the Performance Medicine Show. We do this every single Tuesday at 7 p.m. I'm going to put this up for Katie here. Like we said earlier, the Black Friday sale is all week Black Friday. We're going to be putting this up over the next couple of weeks, so you guys can check that out and see if anything is interesting to you. We will keep doing it. Doc, man, thanks so much.
Good night, Ben.
All right, guys. Love to all. Love you, Ike. See you guys later. See you, Bianca. Where's my outro? Ike, give me an outro. Ike, give me an outro.
Don't go away.